level of the T12. Then it enters into the abdomen, and finally here it divides into three groups. What are these three groups and which branches arises from these three groups, and what are these structures that are supplied by these three groups? We will discuss each and every branch in detail. So the abdominal aorta, I told you, it arises from it is a continuation of the thoracic aorta. Then here the diaphragm, it enters the abdomen, and then at the vertebral level of the T12. And then finally, at the L4 vertebral level, it divides into two branches. Common iliac branches further divides into the internal and the external iliac branches, just opposite to the sacroiliac joint. So you are done with the origin of the abdominal aorta and the bifurcation of the abdominal aorta, where it divides into the two arteries, common iliac artery, then the common iliac artery finally divides into the external iliac and the internal iliac artery, just opposite the sacroiliac joint. Now the branches of this abdominal aorta through which the whole GIT is supplied. Different names are written in different books. I will explain each and every term. It is written in the books also, in your textbooks also. Paired visceral branches means two in number simply. And in some books it is written, mentioned lateral, means these branches originate laterally from the aorta. Paired visceral, they supply to the visceral structures. What are these? These are renal, suprarenal and gonadal branches. If it is in female, then it will be ovarian, and in males, testicular. So for this, paired visceral branches, and we can also term these branches lateral branches. That means they arise from the lateral side of the abdominal aorta. Moving on to the next, that is the unpaired visceral branches, single branch. This group arises from the anterior midline. Anteriorly, it arises from the abdominal aorta, and branches include the celiac, superior mesenteric, and the inferior mesenteric. These superior, inferior, and celiac, these are not new terms for you. Celiac, superior mesenteric, inferior mesenteric. Single anterior midline branches, that means they arises anteriorly from the abdominal aorta, and it supplies to the viscera. This whole supplies to the digestive tract. Paired visceral supplies to the renal and the endocrine system. Now the paired abdominal wall, this group arises posterior-laterally, not only laterally, posterior-laterally, and it includes inferior phrenic arteries and the lumbar arteries, plus one artery, which we can place this artery into fourth plane. Because why we are saying this? Because it is single artery, but it is the parietal branch, not the visceral branch, and it originates posterior to the bifurcation of the aorta. Single unpaired parietal branch, that is the median sacral branch. So we have three groups: paired visceral branches, renal, suprarenal, 2. They are 2 in number, and the gonadal branches, right and left renal, right and left renal, suprarenal, right and left renal. Unpaired visceral branches, single, and they originate from the anterior surface of the abdominal aorta, celiac, and midline means single. Celiac, superior mesenteric, inferior mesenteric. Learn these branches by heart. Paired abdominal wall, that supplies to the abdominal wall, lumbar arteries and the inferior phrenic artery. They originate posteriorly. Then we have a single set of the median sacral artery. Now you can see in this slide different branches of the abdominal aorta: celiac, superior mesenteric, renal, suprarenal. Here we have the renal artery, suprarenal artery is great. Okay. Superior mesenteric, suprarenal, renal, inferior phrenic. This is the celiac trunk. Anteriorly originates celiac, superior mesenteric single, inferior mesenteric single. Okay, getting my point? Paired suprarenal artery means it is present on this side also. Gonadal again present on this side also, and one left renal present on this side also, right as well as on the left side. Inferior phrenic, posterolateral region, and another that is the lumbar arteries. They are posterolaterally originated. This here we can see the median sacral artery, and it originates posteriorly at the bifurcation of the abdominal aorta. Now I think you all are able to understand and easily differentiate between the three groups of the abdominal aorta. Now we will discuss in detail how these tests will provide blood supply to the whole gut. First, we will discuss the suprarenal, gonadal, and the renal branches. That means the paired visceral branches. First, we will discuss the paired visceral branches. Paired visceral includes the renal artery. Here we have the right renal artery. You can see renal artery, right renal. This is the right side and left renal artery. Right and the left renal artery. These right renal artery is much longer as compared to the left renal artery, and they both renal artery is situated behind the inferior vena cava. These renal arteries, each renal artery, right or on the left side, they supply two branches. One branch to the gland, suprarenal gland. You can see over there the gland on the superior pole is simply called the suprarenal gland. And this renal artery, either on the right side or on the left side, gives another branch to the urethra called the ureteric branch. So the branches of the renal artery, origin of the renal artery from the abdominal aorta, it belongs to which set? Paired visceral branches. And it gives two branches. What are these two branches? Ureteric branch and the suprarenal branch. Two branches originates from the renal artery. So the first branch or the first set we have done with this. Now talking about the suprarenal and the gonadal branches, which includes the testicular and the ovarian arteries. Suprarenal branches on both sides, right and left. Suprarenal branches. Here you can see this is the suprarenal gland, and the renal artery is responsible to supply the suprarenal gland on the right side as well as on the left side. So suprarenal artery again divided into superior, middle, and inferior suprarenal artery. How many branches? Superior, middle, and inferior. On both sides you can see this suprarenal gland, and it is supplied by the renal artery. Now the gonadal arteries or the gonadal branches, and each renal artery I told you gives two branches. One branch to the gland, another branch to the ureter. That is the ureteric branch. Now the gonadal branches, for the gonads, ovary and the testes, right? And you can see in this slide, they again are paired. Two in number, right gonadal, left gonadal. This is the right gonadal, and here we have the left gonadal. This right gonadal and left gonadal origin of right and left gonadal again from the abdominal aorta, and right gonadal, this right gonadal will cross the inferior vena cava, then it slopes downward, it also crosses the ureter. So it supplies the middle part of the ureter also. The course and origin of the gonadal arteries for the testes and the ovaries are same initially. Later on, then it goes downward, it goes into the pelvic rim, and here it supplies the pelvic structure, and then the blood supply is different. Origin and course is same before the pelvic origin. Right gonadal artery and the left gonadal artery, or we can say the right testicular artery or the right ovarian artery. So we talked about the gonadal branches, right or left, that means paired. Suprarenal branches, right or left, paired. and the renal, right or left, paired. They all supply to the viscera, so they are called paired visceral branches. This is the slide showing the gonadal branches. You can see in this slide the left renal artery. Again, here is the right renal artery, means paired, and they supply to the viscera. They originate laterally, left testicular, and if it is female, then we can simply say left ovarian artery. Right testicular or right ovarian artery, look at this slide, they cross the inferior vesicle and then it also crosses the ureter. It supplies the middle part of the ureter also. And then it goes downward. This is the right ovarian or the testicular artery. So this is all about the gonadal branches, suprarenal branches, and renal branches of the abdominal aorta. Now another set that includes the inferior phrenic and the lumbar arteries. Which set it belongs to? That means it arises from the posterolateral part of the abdominal aorta, and these are paired branches to the abdominal wall. These supplies to the abdominal wall structures. Lumbar arteries, as the name indicates, supply to the bones. Lumbar artery, spinal segment. Inferior phrenic artery. Inferior phrenic artery are two in number, right and left, and they simply supply the diaphragm. Phrenic is always used for the phrenic nerve term associated with the diaphragm. So here we have the inferior phrenic artery, right and left, and they supply the diaphragm. Moving on to the next, that is the lumbar artery. They are four in number, and they further divide into posterior and the spinal branches. They hug the bone, the lumbar vertebrae, and then goes downward and it supply the spinal cord and the all the lumbar vertebrae. That is supplied by the lumbar artery. So we have the inferior phrenic and the lumbar artery, and they both originate from posterolaterally from the abdominal aorta. This group related to the paired visceral branches to the abdominal wall. It supplies the abdominal wall. One more important thing related to the abdominal arteries, these abdominal arteries also supply the psoas muscle and the quadratus lumborum muscle, lumbar arteries. You can see in this slide the lumbar arteries, how they divide further and it supplies the spinal cord and the segmental artery. This is the abdominal aorta. They take further branches, two branches, posterior and the spinal branches or the segmental branches that originates from the lumbar artery. Now, one left that the most of the books written, it is considered as a single artery. Another plane we can consider for this artery, median sacral artery, that originates at the bifurcation of the, this is the abdominal aorta, at the bifurcation of the aorta posteriorly. And this is a single artery. It passes through the sacrum and coccyx and then into the pelvis, and finally it supplies the structures in the pelvis. This is called the median sacral artery, unpaired parietal branch, unpaired single parietal branch that originates posteriorly midline from the abdominal aorta, and it supplies the sacrum, coccyx, and then finally it goes into the pelvis to supply the pelvic structure. Now again, I want to move on the first slide. To recall once again, we are done with the paired visceral branches, renal, suprarenal, gonadal. Unpaired visceral branches, single, and it originates anteriorly. Celiac, superior mesenteric, inferior mesenteric. Paired, two in number, inferior phrenic, right and left in number, lumbar, paired in, dono sides में. And they are total number for lumbar vertebrae 1, 2, 3, 4, 4 in number, lumbar artery. And then the median sacral artery, posterior to the bifurcation of the aorta, single unpaired parietal branch. Now the branches that will supply the whole GIT. For this, we will discuss first the primitive gut. The whole primitive gut is divided into four parts, the three parts: foregut, midgut, and hindgut. And all these structures, boundaries of these three parts, primitive gut, that is the foregut, midgut, and hindgut, is directly related to the areas supplied by the branches of the abdominal aorta. So the primitive gut starts from the foregut, midgut, and the hindgut. What is this foregut, where this foregut starts, and how it supplies the different structures? Now the foregut starts from the esophagus and ends before the major opening of the major duodenal papilla. And this part of the foregut includes the esophagus, stomach, liver, pancreas. Spleen is also included in this part, foregut part. And it is purely supplied by the celiac trunk. That means branches from the celiac trunk is responsible to supply the gallbladder, pancreas, esophagus, stomach, duodenum before the opening of the major duodenal papilla. So foregut is purely supplied with the celiac trunk. Now the midgut. The blood supply for the midgut comes from the superior mesenteric artery, and superior mesenteric artery is a branch of the single anterior midline branch of the abdominal aorta. Now the parts of the midgut just below the opening of the major duodenal papilla up to the transverse colon. Transverse colon, we have divided the transverse colon into 2/3 part and 1/3 part. Right 2/3 part, left 1/3 part. So it supplies up to the right 2/3 part. Begins just below the major duodenal papilla and ends at the junction of the proximal 1/3 and distal 2/3 of the transverse colon. This includes the duodenum, jejunum, ileum, cecum, ascending colon also, appendix, and proximal 2/3 of the transverse colon, the right part. Proximal 2/3 and distal 1/3. Here it is written proximal 2/3 and the distal 1/3. Now the blood supply for the midgut is purely from the superior mesenteric artery. The structures remaining in the hindgut. So three primitive gut origin from three sources: foregut, midgut, and hindgut. And you have to learn in the same sequence. Foregut branches from the celiac trunk, midgut branches from the superior mesenteric, and hindgut branches from the inferior mesenteric. Inferior mesenteric includes the transverse colon, the remaining part, or we can say left colic flexure. What left colic flexure can also be called the splenic flexure. That is, there are two bendings or curvatures in the whole intestine curvature, and this left colic flexure is ascending colon. We have the ascending colon and the transverse colon, and finally the descending colon. So two bends or curvatures are present. Left colic flexure can also be called the splenic flexure. Similarly, the right colic flexure can also be called the hepatic flexure. So it begins at the point where the left colic flexure starts, means the remaining left part of the 1/3 part of the transverse colon goes down of the large intestine, and then it ends at the anal canal. So this includes the descending colon, sigmoid colon, and the anal canal, rectum plus the anal canal. This all hindgut is supplied by the inferior mesenteric artery. You can see in this slide the foregut, midgut, hindgut. The whole foregut, including the spleen, pancreas, liver, also is supplied by the celiac trunk. The midgut is supplied by the superior mesenteric, and the hindgut is supplied by the inferior mesenteric. All these three sources, celiac, superior mesenteric, inferior mesenteric, comes from the abdominal aorta. Now the celiac trunk. The first one that is responsible to supply the foregut, and foregut may we have the stomach, spleen, pancreas, and branches of the celiac trunk, 3 in number. left gastric, common hepatic, splenic. You can see in this slide also. Here we have the left gastric, the celiac trunk. It gives the left gastric, splenic, and the common hepatic artery. Again, the celiac trunk, three branches: splenic, left gastric, common hepatic. Now we will discuss in detail the celiac trunk that originates from the abdominal aorta, how it supplies the stomach and the duodenum also at different parts before the opening of the major duodenal cavity. This celiac trunk gives rise to the left gastric artery plus the hepatic artery, common hepatic artery. Common hepatic artery again, it divides into the proper hepatic artery and the gastroduodenal artery. You can see in this slide the gastroduodenal artery. Again, moving backward. Common hepatic, splenic, left gastric. So common hepatic artery gave rise to two further branch into the gastroduodenal artery and the hepatic artery proper. Then you can see in this slide hepatic artery proper. Here is the hepatic artery proper. Again divides into right and left branches, right and left hepatic artery. And the right hepatic artery will give the cystic artery that supplies the gallbladder. Common hepatic artery, that is the branch of the celiac trunk. Here you can see the common hepatic artery. This is the common hepatic artery which comes from the celiac trunk. The celiac trunk comes from the abdominal aorta. This gave rise to another branch, that is the hepatic artery proper. This hepatic artery further branches to right and left hepatic branches. And the right hepatic branch will give cystic branch that supplies the gallbladder. This common hepatic artery gives two branches, gastroduodenal and the hepatic artery proper. Gastroduodenal artery. Here is the gastroduodenal artery. This gastroduodenal artery again divides into superior pancreaticoduodenal artery, number one, and right gastroomental artery that passes through the greater curvature of the stomach. Right gastroomental artery supplies the greater curvature of the stomach. And superior pancreaticoduodenal artery that originates from the gastroduodenal artery. This gastroduodenal artery, where it comes from the common hepatic artery. You can see in this slide, common hepatic artery further दो में डिवाइड हो गई कॉमन हेपेटिक आर्टरी. कौन कौन सी में? प्रॉपर हेपेटिक आर्टरी, ठीक है, प्रॉपर हेपेटिक आर्टरी, gastroduodenal artery, and then this gastroduodenal artery again divides into two. What are these two branches? Superior pancreaticoduodenal artery and right gastroomental artery. Cystic artery, we are done. Cystic artery supplies the gallbladder. Now the superior pancreaticoduodenal artery will supply the head of the pancreas plus the first two parts of the duodenum. That is supplied by the superior pancreaticoduodenal artery. Now left gastric artery, we are done with the left gastric artery. Right gastric artery left. And the superior pancreaticoduodenal artery, we are done. Inferior pancreaticoduodenal artery left. Now these are the branches of the celiac trunk. You can see in this slide also gastroduodenal artery, superior pancreaticoduodenal artery, right gastroepiploic artery can also be termed as right gastroomental artery. Okay, celiac trunk. Celiac trunk gives how many branches? 3 branches. What are these? Splenic artery, left gastric, hepatic artery proper. Then the hepatic artery again divides into right and left hepatic artery, and only the right hepatic artery gives cystic branch to the gallbladder. Splenic artery, now come to the splenic artery. Splenic artery gives short gastric branches that supply the fundus of the stomach, short gastric branches. Plus, it also gives a branch left gastroepiploic artery. Splenic artery gives One branch, that is the left gastroepiploic artery, and it gives short gastric branches that supplies the fundus of the stomach. Okay. Splenic artery, largest branch of the celiac trunk. Its course is tortuous. It gives two branches, left gastromeatal branch that anastomose when it passes through the greater curvature of the stomach with the right gastromeatal artery. It gives short gastric branches that supplies the dome of the stomach, and it runs in the sphenorenal ligament. Common hepatic artery, we are done with this. It gives hepatic artery proper, and the gastroduodenal artery. This gastroduodenal artery again divides into two. Hepatic artery proper divides again into two, right and left hepatic artery proper near the porta hepatis. Only the right hepatic artery will supply the cystic artery to supply the gallbladder. That means all the structures that are part of the foregut are supplied by the branches of the celiac trunk. This is these are the branches of the celiac trunk: common hepatic artery, left gastric artery, and the splenic artery. Splenic artery gives two branches, short gastric branches and the left gastroepiploic artery, or we can also say left gastromental artery. Gastroduodenal artery, we are done with this. It supplies the first head of the pancreas plus the first and second part of the duodenum, the superior mesenteric artery. Now, the second important branch of the abdominal aorta of the celiac trunk, and it is again single anterior midline branch originating from the abdominal aorta. This branch gives inferior pancreaticoduodenal artery, duodenal and ileal branches, middle colic, right colic, and ileocolic branches. These are the branches of the superior mesenteric artery. And this superior mesenteric artery will supply all the structures just deep to the major duodenal papilla, and it includes the structures of the whole midgut. Look at this slide. The mid-colic, right colic, and the ileocolic, they will form the marginal branches, and then the arterial arcade surrounding the whole large intestine. These are the middle colic, right colic, and ileocolic originating from the right side. Right colic and the ileocolic. Middle colic, right colic, ileocolic. They all are branches of the superior mesenteric artery. They will supply the duodenum, ileum. Ileocolic artery again divided into ascending and descending branch, anterior or posterior branch, plus it gives one more branch to the appendix, ileocolic artery. Ascending branch of the appendicular branch of the ileocolic artery. Just like the hepatic, proper hepatic artery, the right side branch gives a single branch, cystic branch that will supply the gallbladder. Ileocolic artery gives an additional branch, and this will supply the appendix, appendicular branch of the ileocolic artery. This ileocolic artery divides into anterior and the anteriorly for the blood supply, all the anterior surface of the ileum, and for the posterior surface of the ileum also the posterior division. Now, the inferior mesenteric artery that will supply behind the structure include the rectum, anal canal, descending colon, sigmoid colon, smallest of the all three anterior midline arteries. Branches of the inferior mesenteric: left colic, sigmoidal artery, 3 to 4 in number, and the superior rectal branch. Left colic branch again divides into left colic, I'm repeating again, left colic, sigmoidal, and the superior rectal that will supply the rectum and the anal canal. Left colic will divide, not the sigmoidal, not the superior rectal. Left colic will divide into ascending and the descending branch. Ascending branch of the left colic will anastomose with the middle colic of the superior mesenteric artery, and the descending branch of the inferior mesenteric artery anastomose with the sigmoidal artery. Sigmoidal arteries, 3 to 4 in number. Superiorly it anastomose with the left colic, and inferiorly it anastomose with the superior rectal artery. You can see in this slide the branches of the inferior mesenteric artery, sigmoidal artery, superior lateral artery, left colic artery. This is the left colic artery. Right colic, middle colic, ileocolic, they all are branches of the superior mesenteric. Only the left colic is a branch of the inferior mesenteric artery, and this is responsible to supply all these structures that are derived from the hind leg. So first we have to learn the developmental anatomy of the primitive gut, that is the foregut, from where the foregut starts and where it ends, structures including in the midgut and structures including the hindgut. Then sequence-wise, these branches are directly responsible to supply the foregut. Celiac trunk is responsible for the midgut, the superior mesenteric is responsible, and for the hindgut, inferior mesenteric is responsible. Now, clinical related to the abdominal aorta, that is the abdominal aortic aneurysm. What happened in this? There is inflammation or dilatation, fusiform or sac-like dilatation of the abdominal part of the aorta. Look at this slide. This is the normal aorta, and this is the fusiform or sacral dilatation of the abdominal part of the aorta. And the symptoms usually not present, but if this will rupture, it will result in excessive bleeding, profuse bleeding. Causes can be vascular inflammation, high blood pressure, or smoking. Surgical procedure can be used for the treatment. Catheter can be induced depending on the size and severity of the aneurysm, and this stent is placed inside to manage the shape and to reinforce the weak point where this bulging occurs in the abdominal aorta. Now, any question related with this, the whole blood supply, starting from the superior mesenteric, inferior mesenteric, celiac trunk. First slide, going to the first slide. Celiac trunk. Any question related to this? The head of the pancreas is supplied by both superior pancreaticoduodenal and also by the inferior pancreaticoduodenal. Superior pancreaticoduodenal is a branch of the gastroduodenal artery. Inferior pancreaticoduodenal is a branch of the inferior mesenteric artery. Now, any question related to this up to now? The whole blood supply of the GIT. Three branches are there: celiac trunk, superior mesenteric, and the inferior mesenteric. Suprarenal artery. Now, the left gastric artery and the you can see in this slide the left gastric artery, and here we have then the right gastric artery. Left gastric artery will supply this is the right gastric artery, and the left gastric artery, they both will supply the lesser curvature of the stomach. And the greater curvature of the stomach is supplied by the left gastromental artery, or we can also say left gastroepiploic artery, and the right gastroepiploic or the right gastromental artery. They both will supply and form the lesser curvature of the stomach. Suprarenal artery, first. Suprarenal. Okay. Suprarenal artery, they both suprarenal arteries on the right side as well as on the left side originate from renal artery. I told you renal artery gets two branches, ureteric and the renal, and they both are present. Renal branches are present on both sides, right and left. They are paired visceral branches. Then the suprarenal artery again divides into superior suprarenal artery. For example, this is left side, left superior suprarenal artery, left middle suprarenal artery, left inferior suprarenal artery. Gastric artery. Any more question related to this? The blood supply of the abdomen. Ureteric branch and the suprarenal branch. Renal artery gets two branches, ureteric branch and the suprarenal branch. It descends down, but it crosses the uterine supply in the middle part. That's why it gives two branches, the urethric branch and the suprarenal branch. Two branches originate from the gastroduodenal artery. What are these two branches that originate from gastroduodenal artery? Right gastroepiploic artery and the superior pancreaticoduodenal artery. These are the two branches that originate from the gastroduodenal artery, and splenic artery gives two branches, short gastric and the left gastroepiploic artery. Celiac trunk, total three branches, common hepatic, left gastric, splenic. Common hepatic then divides into hepatic artery proper and the gastroduodenal artery. Any more question related to the blood supply of the whole GIT? Clinical only one, that is the abdominal aortic aneurysm. Yes, please. Any question related to the blood supply? First, what are the best way to learn the blood supply of the GIT? First, learn the whole derivatives of the foregut, midgut, and hindgut. Then the branches of the trunk, celiac trunk branches, initial branches. Then what are the branches of the, then finally the division of the gastroduodenal artery, superior mesenteric, its branches, inferior mesenteric, its branches. Aneurysm, abdominal aortic aneurysm can be due to vascular inflammation and inflammatory condition, or high blood pressure, or smoking can lead to the abdominal aortic aneurysm. Yes, any more question related to this? Okay. So we are leaving this meeting over there. If still you have any query, feel free to ask.